The question here, a nurse diagnosed of ineffective airway clearance related to the pain is identified for a client who had a open abdominal surgeries 2 days ago. And which intervention should the nurse implement first? So as a RN, when we go for the assessment a patient after surgical operation, because you say examiner wrote in the second part of this question, the client who had open abdominal surgery 2 days ago. So after surgical operation, when patients are immobilized, the patient have a chance to develop some complication like pneumonia, like atelectasis, and also we have to assessment the respiratory system, airway first. We can assessment for the breathing, then we go for the assessment circulatory system and vital sign. Assessment respiratory system or airway or breathing is the first priority. During the assessment, I found them ineffective airway clearance. So if any extra secretion up there, we must clear it, must suction do this, right? But what are the underlying cause? We also remove it as well. So there are 4 options. Which one is the most important to take the first? So which intervention should the nurse implement first? 4 options we said. Administer the prescribed analgesic medication for incisional pain. This is the answer, but I'm going to read for number 4. Promote the promote to increase the oral fluid intake. So a patient after surgery or even after 2 days, this patient, you definitely encourage them, promote them to intake the fluid, but definitely it is not the first priorities. Fluid intake is important, but this patient, nothing related to input-output complication. Offer an additional pillow to the splint incision. So little bit pressure on the incision. So when patient go do coughing or anything, it can support, but also it is not a professional way to tell your patient to put a pillow first. What next? Encouraging use of spirometer every 2 hours. So definitely it is a good choice. Every 2 hours spirometer check. Also, here said, number 1, admin the prescribed analgesic medication for incisional pain. So number 1, we chose, reason being the ineffective airway clearance because of pain. So if you remove the pain, patient will feel good, and also after the secretion, suction, patient feel okay. And also number 1, we chose admin prescribed. So what is prescribed by the healthcare provider, we have to follow the direction, right? Analgesic for the pain. And also the pain is one of the vital sign. You have to check it first. If I talk about the Maslow's law, the first priority in these cases, first priority pain management. We have to go for the manage the pain or pain medication. So they choose number 1. And what is their explanation? Let me read it first. The post-operative client, because this patient 2 days ago have done the surgical operation has a risk, the client at the risk to develop atelectasis or have a developed to chance pneumonia following the surgery as a result of retained secretion. So when too much secretion in the respiratory system, it leads to the inflammation or infection of the lungs, and we called pneumonia, right? And if pneumonia is not treated or other underlying cause not treated, the lungs is undergo partial or complete collapse, and it is called atelectasis, right? So this is the key word we have to know. So now effective cuffing is essential for the prevent less complication. The nurse can promote many client action that will facilitate the effective cuffing, right? So here, including, so what are the nursing care should be included? So incision while cuffing and changing the position every 1 or 2 hours, ambulating early and using an spirometer. Also hydration adequately. All is nursing care, but most priority for this patient pain management. Like I said, if the patient has a respiratory problem, their position should be high faller. Give them some oxygen. Encouraging for cough or deep breathing exercise. Using spirometer and also increase the fluid intake. All is nursing care for the patient who have the complication like atelectasis or pneumonia or after surgical operation. But pain relief should be addressed first to implementing cuffing exercise and ambulation. What are the educational objectives? The nurse should ensure that the postoperative client has effective pain relief before performing the cuffing exercise. So here I said we always encourage cuffing or deep breathing exercise. Very important. So the question number 2, the nurse is providing the care for a client with a cancer of the left lung, which undergo the video assist through with a thoracic surgery in the morning. The client is nervous, jumpy, and short of breath. After checking his vital sign, we found the pulse rate is 120 per minute. So it is tachypnea, tachycardia. Also respiratory rate is 30 per minute. So pulse rate it indicates respiratory rate increase. Patient has a tachycardia and tachypnea. Means patient is under anxiety. Definitely. If anybody diagnosed with a cancer and talk to the surgeon for surgical procedure, and after the situation, it is very hard for them to adjust. And my patient is very nervous, have a shortness of breath, pulse rate up, respiratory rate up. And also, when we auscultate the lungs, we found added sound wheezing. Wheezing is most common in bronchial asthma. So which of the following is the priority? So in this question, asking what are the most common priorities nursing action. Administer prescribed intravenous morphine 2 milligram to relieve the anxiety. So morphine we can use for pain. Morphine we can reduce the anxiety, but morphine also have some side effect because morphine can cause respiratory depression. So we do not go anything like this, suddenly give the morphine, right? So this respiratory therapist administer inhale bronchodilator and nebulizing. So patient have some shortness of breath, wheezing, give them some oxygen. So after the assessment, the respiratory status, we go for bed rest or give them some oxygen. Nothing wrong, right? Nothing wrong. But what next? What are the other options here? Place the head of the bed in folar and high folar positioning and stay with the client, encouraging the client to discuss the feelings. To be honest, here what is writing number 2, number 3, number 4, all is important. All we do step by step. But which one is the first? Which one is easy for my patient? Just do this and go for the next. So I said bed rest is important, and during the bed rest we always think about the position of the patient, right? So place the head of the bed in folar or high folar position. This is the nursing action or nursing care. Position a patient in a high folar, then give oxygen as prescribed, or then give them bronchodilator as prescribed. Then go for encourage for the coughing or deep breathing, or give them spirometer. So nothing wrong, but first is first. Simply change this their position, and it can help them to expand the lungs, take more oxygen in. And also stay the client. Yes, we will stay. We encouraging the patient to verbalize their feelings. It reduces the anxiety, but not fast, later on. So what is their explanation? They said here, elevating the head of the bed to folar or high folar position is a priority of nursing action to help to relieve the shortness of breath, facilitate the oxygen to the lungs, and also promote lung expansion. Alternate position to high folar include, right? It is easy to high folar. Then when you have time, you can explain what are the different position. One is called orthopenic position, and other is called tripod position. So basically here, orthopenic and tripod positioning is very important for respiratory patient. And in this picture, you can see this patient is sitting corner of the bed and holding to elbow over a pillow, right? And also this picture is a little bit folar position. So here they said orthopenic position, sitting in a chair or on the side of the bed or on the bed, leaning over the bedside table with one or more pillow under the arm or elbow for the support. When patient go for tripod position or orthopenic positioning, their lungs will be facilitated for oxygenation or promote the lung expansion. It helps. What is tripod? Sitting in a chair, leaning forward with a hand or elbow resting on the knee. Sitting upright and leaning forward, pull the scapula apart, promote the lungs expansion, and decrease the diaphragmatic pressure, proceed the viscera. So both cases help our patient for get better oxygen and get more lung expand. So what is most important here, what is we learn from here? So during or dealing with respiratory patient, the teaching your patient or nursing intervention is super important. We assessment the respiratory status, then we change their positioning like high polar positioning or orthopedic position or tripod positioning, then go for oxygen, or also educate them how to pursue deep breathing or deep breathing exercise. Tell them not to smoke or avoid exposure to the cold or dust or allergen. It is help. And also we tell to intake enough fluid, and also we will check the respiratory system for if any excess secretion. So in this question, we can say the nurse review and reinforce an asthma action plan with a client who has a moderate persistent asthma. Which statement by the client indicate understanding how to follow a plan approximately when peak expiratory flow reading are green, yellow, and uh, red zone. So this, you can see this is the picture, and this picture are peak flow metric reading. So patient who are severe bronchial asthma or moderate bronchial asthma, they can use it, and then they can identify what are the level of their lungs condition. Then they can take the precursor to avoid any kind of danger or acute attack. So there are four options. They said which statement by the client indicate better understanding. So which one is a good understanding, not a wrong understanding, right? Our patient has a asthma. Asthma, actually chronic inflammatory disorder of the airway. It is intermittent and reversible. But if you talk about the COPD, COPD is not a reversible. I mean, chronic obstructive pulmonary disease is irreversible lung problem, but asthma is reversible. Usually, asthma patients have a wheezing, coughing, or prolonged exhalation, right? So, what are the four options? So, if patient said, if I am in the green zone, so green zone means maximum, and you are okay. There are no risk factor. So if your patient have a asthma, chronic asthma, always we go for pulmonary function test, shortly called FVP or FEV1. So they said means peaked expiratory flow 80 to 100%. It is good, nothing bad. but I am coughing, wheezing, and I have more trouble of breathing. So if you are in the green zone, you do not have any cough, you do not have any wheezing, okay? You do not have any shortness of breath. I will not make any change in my medication. But here is a missing information, means it is not understanding. When you are green zone, you do not have any sign and symptom of the disease, like no wheezing, no coughing, and also saturation of oxygen will be up. But number two, if I'm in the yellow zone, this is the yellow zone, 300 to 500, 50% to 80%, and I return to green zone after taking my rescue medication. It is good if you take the medication like bronchodilator or anticholinergic medication like ipratropium bromide or anti-inflammatory like corticosteroid. You can feel good from green to go, from yellow to go green. But what next? I will not make any change in my daily medication. I return to the green zone after taking my rescue medication, and I will not make any change. But if you are in the green zone, definitely you need to follow up. In number two does not talk anything about the follow up, but they need to follow up because green zone is our target. Number three, if I am in the yellow zone 50 to 80, I will take my rescue medication every 4 hours, 1 or 2 days, and call my healthcare provider for follow-up. Yes. Now, when you're green zone, it is stable. When you are the red zone, it is so bad, need to emergency, go to emergency. But when you're green zone, you are unstable. You maybe go green, you maybe go down in red zone. So you need regular follow-up. So number three is most accurate. Number four, if I am remain in the red zone, my lips are blue and my peaked expiratory flow still less than 50% of my personal best reading after taking my rescue medication. I will wait 15. No, you are not wait 15 minutes. You have to go for emergency or call for ambulance or call for 911 because it is status asthmaticus almost. Airway obstruction is unresponsive to the typical treatment. They need some extra care. Give them oxygen, give them bronchodilator or epinephrine, and prepare for emergency intubation if need, if when they are in the red zone. What is their explanation? Let me read it. The asthma action plan is an individual management plan developed a collaboratively between the client and healthcare provider to facilitate self-management of asthma. As I told you, asthma is a chronic inflammatory disorder of airway. So they need to control the disease. They need to go regular follow-up to the doctor office. It includes information to daily and long-term treatment, also prescribed medication and when to take them, then according to the zone system, how to manage worsening symptom or acute attack of chronic bronchial asthma, when to call healthcare provider or when to go for emergency department. So if your patient are educated how to use the peak flow meter reading or what are the meaning of peak expiratory flow rate, they can manage themselves when they should go, when they need to follow up, right? what are the danger sign, and what are the stable. The action plan using the traffic color zone. So this is the red, yellow, and green. This is the traffic color, and categorized into zone, degree of asthma symptom, severity, and airway obstruction, called peak flow meter reading. This is the peak flow meter reading. What next? So now we are talking about the what color for what. Let me read it. So this is the green zone here, indicate asthma is under control. Okay, and also the peak expiratory flow is 80 to 100%. When in the green zone, there are no worsening of cough, no wheezing, no shortness of breath. Means it is under well control. When in the yellow zone, means they need some precursor. Even on return to the green zone after use of rescue medication like oxygen or bronchodilator, epinephrine, or ipratropium bromide, further medication or change to the treatment is needed, so they need to follow up. In the red zone, indicate the medication alert, also the medical alert means they need to go emergency. Also the signal the need for immediate medical treatment. If the level does not return to yellow, immediately after taking rescue medication, they have to call for ambulance. What are the education objectives? Let me read it. A peak flow meter uses the traffic signal color to categorize the level of asthma symptom, mild, moderate, or severe attack. Green zone indicate asthma is under control. Yellow zone indicate they need some precursor or they need to follow up or symptom are getting worse. Also the peak expiratory flow is 50 to 80% of personal best when they're yellow zone. And there is a need for further medication. Red zone indicate need for emergency management. And I told the status asthmaticus. And if the level does not immediately return to yellow after taking the rescue medication, and we should prepare for emergency intubation.